Okay, so we'll make a start. Thank you, everybody, for to all the panelists for agreeing at relatively short notice to join us today, and for all the many of you who've signed up and subscribed to the webinar. Just to introduce myself, my name's Danielle Morley. I'm the Chief Executive at Bonsucro. As you know, we are the Sustainable Sugarcane platform, and I'm talking to you all today from all around the world, from my home in London. There's many of you on the call today, and we've made this webinar available and open to to anybody who wanted to join us. It's not exclusive to our members, so welcome to those of you who might not be a Bonsucro member, as well of course to our dear members. Very briefly, the format will be some opening remarks from me, and then we have our speakers who will each be making a presentation, approximately 10 minutes presentation. At the end during their presentation, you can use this function at the bottom of your screens. You will see it says Q&A. And if you click on the Q&A function, you can ask some questions through the course of their presentation. If we're able to respond to your questions contemporaneously, we will do so in that chat box, and I will pull out 2 or 3 key questions that you've asked for a verbal discussion with the panelist at the end. But we'll do that at the end. We'll do the verbal Q&A at the end of the 5 presentations. So that's briefly the format for today. I'm sure you're all pretty familiar with this Zoom technology. It seems to be the technology of choice in the past few weeks. We've recently just upgraded to this webinar package, but it's super intuitive, so it should be fine. And just to repeat for those who didn't hear my previous announcement, we cannot see or hear all of you lovely 90 or so people who are dialing in today, so you can relax. You can see us, but we can't see you. And there's also an opportunity, I think, to raise your hand in that Q&A function as well. Any problems, put it in the chat box. Any technical problems or any other issues, just put it in the chat box. And I have 2 of my team are moderating as well for us, so they'll help to sort things out for you. So that's just briefly on the format. I hope that's fine for everybody. So today we're talking about the challenge of COVID-19 and its impact on all of us, on your workforce, on our communities, on our businesses, and in particular how the sugarcane business has been responding and will be responding to mitigate the devastation of this pandemic. What we know today is that the virus is highly infectious. We know it's infected at least 2 million people already around the world. And the WHO saying that as of today, 125,000 people have died. It's probably higher. We know that about half of the world's population are currently living in some form of quarantine at home, and our governments have closed down the borders, non-essential business, and schools. So clearly, people are being really hit hard. And while the virus itself can and will infect anybody, the impacts of this pandemic are going to be felt most dramatically by the poor and the marginalized and vulnerable people in our society. And at the same time, business and the economy are also being really hard hit. And in particular, the agricultural supply chains, of which we are all a part, are being disrupted. And we know that you, our members, are going to be potentially facing some real challenges. We know that the restrictions on movement are dramatically affecting agricultural labour and transport logistics. We know that the disruption and the uncertainty surrounding the pandemic is triggering more volatility in commodity prices. But unfortunately, we also know that all of us are going to have to learn to manage with this virus out there in our population until there is a vaccination, which, as we know, could be up to 2 years away, if ever. And this means that we're going to have to adapt, and we're all on a very steep learning curve. And I just wanted to share that Bonsucro We're a membership organisation. We are the platform for sustainable sugarcane, and we're here to make a positive contribution and to support the sector and our members through this challenging time in line with our shared mission and vision. I'm not sure yet exactly what that looks like in the medium to long term, but in the short term, we've started off that process by pulling together some practical recommendations for the sector, and the team did a great job rapidly working through the WHO guidance to develop and publish a set of recommendations. My colleague, Nicolas Viart, who's our Director of Standards and Innovation, is going to take us through those key points today. And we were also struck in the news media and by information shared by the quick and very positive response of our membership to the pandemic, who've taken lots of proactive measures to protect health through their core business operations. And we're delighted to have some of those members with us here today. So I'm just going to briefly introduce them. We have Denis Chavarria from Mill San Antonio in Nicaragua. We have my colleague Ritu Baruah, who's our program manager in India. We have Marit Mach, who's the managing director of CNV International. And we have Claudia Asensio, who's the head of sustainability and new product at Pantaleon. Thank you all very much for joining us today. We're going to go through in that order. I think everybody's prepared to speak for about 10 minutes. And as I said, ask some questions as they're going along, if you would like, and then I will identify some key questions and we'll have a Q&A at the end. So if I may hand over to Nicolas to start his presentation.
Thank you very much, Danielle. So Bonsucro looked at supporting the effort of the sugarcane sector and our members and beyond our membership, all the millers and farmers that are facing the issue raised by the appearance and the outbreak of COVID-19. So we looked at the most recognized WHO guidance and we have extracted some element of it and put them in the context of the sugarcane sector, so that it can provide some ideas and inspiration to the millers and the farmers on how to prepare, adapt, and mitigate the impact of the outbreak of COVID-19 into their activities. So the guidance is divided into three sections that we have respected. The first one look at really to preventing the spread. The first fight that operators and communities have to do is really to get ready to prevent the arrival and the spread of the virus into their location in premises. So three key elements are really highlighted by the WHO guidance that now more and more everybody here, almost every day, about those practices. First one is hand washing. The second one is good respiratory hygiene. And the third one is travel prevention and isolation advice. So on the hand washing and sanitation, this is something farmers and millers might do already, a part of some of the elements within the workshops and at the mill, and some of the activities requires a good hand hygiene. But this is to reflect that the virus can come in through so many entries, so many avenues. So it's to relook at the points of possible contamination and ensure that at those points, mitigation measures are put in place and therefore hand washing are in place. So as many and as possible is ensuring hand washing by all the workers anytime and anywhere at the farm, at the mill, and any other location like warehouses, like weighbridge, other locations that are usually a place where hand washing is happening, is really as well ensuring that before coming into the premises, any external person, let's say, and even workers, when they come into the premises, take the habit to wash their hands. And here is really taking the habit, is changing the habit. So make sure that every category of workers, being from CEOs, managers, contractors, and visitors, take as well on board those recommendations. If possible, is increasing the number of hand washing stations and stock of toiletries into the mills, but as well overthinking into the farms as well, and other more remote locations where you can have activities, and communication, displaying poster next to the hand washing to make sure people take the effort to wash their hands as WHO recommends at the minus 20 seconds. The second change of habits that has to be brought to the workforce and to management and visitors is good respiratory hygiene. So really, WHO is clear about it. How to cough is on the elbow with a tissue to make sure that the germ doesn't spread through coughing, because we know it's a very high factor of contamination is coughing. As well is recommending the wear of mask and provision of paper tissue anywhere where necessary within the premises, being again at the farm, at the mill, and all the offices and places where workers might be required to go. So the mask is as well a very good prevention measures, as well as a physical one that show prevention of the spread of the disease. The last point that is highlighted is really travel and isolation advice. So many of our activities, and us included as Bonsucro, but as well some into the mill and the farm activities, are called to travel a lot. Travel can be short distance or can be long distance. You can come from your work to the mill or to the farm, but as well you can travel between farms. So those elements are as well a factor of contamination and spreading potentially the virus. So having and ensuring that those workers and those management and those people, those contractors coming in and out of the mills are made aware of the risks that they carry themselves, and therefore giving them all the advice on how to behave, how to wash their hands, how to sanitize their hands, and how to have good respiratory hygiene. And as soon as those people might display some symptoms, is really to support them in taking the right decision to isolate and to prevent further travel across the premises. The second element of prevention the WHO highlights is meetings. And meetings, we can imagine meetings in a meeting room, but if we look at the activities that we're doing at the farm, at the mill, meetings can be in the field. I can go and meet some farmers. I can go and meet a farmer community. I can go and meet my team at the boiler station. So meetings can happen anytime. So the WHO really recommend to prevent any kind of meeting that can be avoided and to turn on to online meetings like we're doing now from the comfort of our homes. We are doing online meeting, and this is an habit to take as well across within the mill potentially, but as well across various mills within the group with the head office and so on. If meetings can't be turned online because there's still a meeting that happens in situ, it's important to have good practices as well. Social distancing has to be respected within the team. If you gather your team at the beginning of the shift, you're reminding the team leaders to ensure their team members are keeping good social distances. Is to have good practices, hand washing as well, repeating the practice of hygiene, respiratory hygiene and coughing into the elbow if someone needs to cough, and to provide masks, tissues, hand sanitizers, and clothes bin for the discard of those of what needs to be discarded, including as well for outdoor meetings. It should be also reminded that anybody with symptoms should not attend any of the meeting and self-isolate. And an important point is to keep track. So tracking the potential contagion is important. So keeping track of who are attending the meeting is key, because if one of the team member within that meeting falls sick, it will be easier to quickly analyze who might have been contaminated and give them as well the right advice on how to behave, knowing that they might have been contaminated. So the third advice that is provided as well by the WHO is how to react when the virus arrives in the community. Everything before was kind of awareness raising, behaving as if it might be here, so starting to get the habits and training and communicating. Now is really to behave when the virus is within the community. We're here in London, the virus is here, is in our community, and we need to behave slightly differently as we were behaving before. So for that, the mill and the farms have to be prepared and to have planned to act, but as well to react. So those key elements that we've listed in the guidance are ideas and recommendation on what the plan should account for. The first one is really to be clear about what to do if symptoms are identified at work. If a worker or management members or staff member fall sick, what do we do? Who do we go to contact? How do we isolate that person? Do we have space to isolate those persons? For the isolation, it's as well to take into consideration that if your host, by your workers are hosted by the mills of the farm, if there is dormitories accommodation, residence, make sure that there is as well preparation plan in case of the needs of isolation from the workers. How do you prepare already allocating some space to the workers for them to isolate? The important point as well is that when people have to isolate because they have the symptoms, that might mean for them a cost of livelihood and a cut in livelihood. So what we really recommend is make everything to avoid and to prevent that loss of livelihood. Because if workers might be scared to lose their job or lose their livelihood, they want to display the symptoms, disclose their symptoms, and this is the best chance to spread the virus even further. So really thinking how you can ensure the livelihood of the worker that might have to isolate. Again, trace and track the workers that might fall sick to make sure that maybe their colleagues within the shift might be at risk now. So how are we going to, and how you're going to manage those shifts. The plans should as well account for what is going to happen if our workforce is falling by X% because of the rate of disease and sickness. So we be already aware of how you're going to manage the production to ensure there is a continuity of production. The production must continue, but how are you going to adapt the workload, the cadences, and the output objectives to be sure this is realistic and adapted to the situation. As well, you reorganize your teams to make sure there is less contact between the teams. Social distances are respected as well within the workshops or within the fields, unless for safety reasons, contact must happen. So if contact must happen for safety reasons, for the work to be carried out, is ensuring masks are provided, maybe hand sanitizing before working, before being in contact take place. And finally, is really thinking as well, okay, we look at the workshop, what is happening today in our factory, but we need to think to the whole supply chain, preparing of what does it mean if there is a reduced production of sugarcane or harvesting, or if more delayed according to our normal production pattern. Can I export? Can I do the expedition of my ethanol or of my sugar loads? What's happened if I have difficulty to access fertilization? Because as well, those supply chain might be disrupted. What's happened with my clients? Do they need the same amount of volume? Do they need more volume, less volume? How do I adapt all those plans within the logistic and sales department? So really organizing that with them. The last point we put in the focus on is really to community support. Sugarcane farmers and millers always play a huge part into their local community. And this role is even more important now that we need to bind together and to have support and to support each other to go through this crisis. So the crisis will have very devastating negative impact to the local communities, to the workers, to the dependents of the workers, to the family, depending on someone working within those farms or those mills. And we need to think about them. And it's really the matter to encourage everybody to reach out to the charities, the support group, food banks, healthcare services that might be active in the local communities, to really work with them to ensure and to check on, do they have all the supply they need, how you can provide them as well more support. We see a lot of extraordinary support from sugar millers providing alcohol to all those care providers to make sure that everybody has the element in hand for sanitation and protection. So it's really working together to provide support if required. As key takeaways from those WHO guidance and how we reflect for a sugarcane sector is really the key central role that millers and farmers are playing to bind and to support the communities. We recommend really to have an ad hoc COVID-19 committee to be set up that will look at to all those elements from day-to-day production to logistic disruptions to healthcare provision to a level of mental support and general support to the workforce that might be affected, is removing all barrier from the workers to disclose the symptoms, and is always to think beyond the premises of the mill or of my own farm. A lot of activities are carried out by day laborers, by contracted workers that are not directly in link with the mills, but still rely on the mill activity. So if the mill activity has restricted, or those people fall sick as well, they are in a dire situation and we can't forget them. So really going down tier 1, tier 2 of the workforce to make sure that everybody is accounted for. find innovative way to disseminate information. A lot of use of social media is ongoing. I was speaking this morning with some mills, and they were telling us how they're using social media to share videos of training, and awareness rising with smallholder farmers. Adapt to a reduced workforce. Provide all the required training to your health and safety officers and extension officers, because they are key as well to engage with the smallholder farmers and the farming community. And at the end is really share what you've done, because I think everybody is looking for support, innovative approach, solution, ideas, and is really to the benefit of everybody if we can have those platforms like we are intending today to share that information so that can reach to a bigger number, and having the sector to really go through provision to reduce the spread of the virus and go through this crisis. So the guidance is available online, and we are looking at all your feedback on it, and we hope it's proved useful to some of them. To have more of a concrete feel of what you are doing in the implementation of those recommendations, but as well on your work to tackle the virus and the spread and the outbreak of COVID-19. I'm very excited to hear about the experience that Denis Chavarria is going to share with us. Thank you as well for your input into this guidance. It was very useful. So Denis, I'm going to hand over to you. You will be able to share your screen and your presentation. And yeah, just to remind you, are on mute as well. So I can't hear you. Huh? Let's see.
We can hear you now, Denis.
Can you hear me?
Yes.
Yeah, but I can't show my screen. I don't know.
Okay, maybe one of my team can do that for you.
Mm-hmm.
Perhaps while we're waiting for the team to work with Denis on sharing his screen, I might then skip to our next speaker, and then we'll come back to you, Denis. Is that okay?
Yeah, that's okay.
Okay, so I don't know, Ritu, are you ready? Could you come in now while we sort out Denis's screen for him?
All right, thank you, Daniel, and yes, I'm happy to step in.
Thank you.
Good evening, good morning, good afternoon, wherever you are in the world, and thank you very much for joining in again. I would like to present the regional, the work that the region is doing, and in that I would cover China, Thailand, and predominantly the work that is being done in India. In China, the feedback that we have from the mills is that work continues as normal, and they are taking the necessary steps that are required, which includes taking all the measures, doing the temperature checks, wearing masks at work. There are fewer people at work, but the work carries on. In Thailand, what is exceptional is that the mills have organized transport for people to be fetched from their places of work, from their homes to come to work. And yes, they also are carrying on with operations as far as possible, trying to maintain the same pace of work. From India, of course, for me, the report is a little more in detail. And yes, we have been in lockdown. We have, movement has been restricted. But the mills have, because sugar is an essential by law, the mills have been permitted to allow sales. So deliveries of sugar have been carrying on as normal. Of course, the movement of trucks coming into the mill has been regulated, and all precautionary measures for people who are entering the mill have been taken by all the mills. And this information I have gathered by my continuous engagement with all our partners here in India. While we talk of, the crushing season is over here now in India, and the mills were allowed to operate for some time, so that the farmers did not suffer, and most of the cane that was that had to be collected from the farms was done, and crushing did finish in good time. But for some of the mills that had to continue operations for a little longer, they had been given permission by the government to do so. Again, for that, all the necessary precautions that had to be taken for the movement of trucks coming in and the women's, it was scheduled in such a way that there was no rush and there was no crowd at these mills. For the maintenance work that is going on, most of the workers, and in this case, I would say now almost 100% of these workers live within the premise of the mill, so that there is no worker coming in from outside. And all the mills have been taken necessary steps to make sure that there are certain shifts that come in at a particular time. So you know that who are the set of people who've been working together. In case of a problem, then you know that in case you need to quarantine a certain group of people, you know exactly who those people are. But so far, there has no such case been reported. In fact, in some of the areas, although the state of Maharashtra in India has been affected quite badly, but there are some districts where we have mills where there are no cases, and touch wood, they have been really blessed. So, like I had a conversation with one of our members at Lokmangal Agro recently, and they said that so far, they've had no cases there, which is, there are areas like this in India as well. One thing that comes to my mind is also that the mills who have distilleries have also stepped up in the production of making sanitizers, which they are now trying to make available at very reasonable costs to their own people, and also trying to send it out. These are very important needs of the hour, and that's how the sector has stepped in there. As far as farmers are concerned, we will be going into the planting season very soon. The planters, some of them will be needing seeds. So for that, I had a couple of calls with the mills who said that yes, they will supply the seeds to the farmers. The farmers will be approaching their contact person, who will then get in touch with the mill, and again they will be monitoring how those people will be allowed to come in. What will be the frequency, how many people at a time. All those things are being taken care of, just trying to make sure that the seed reaches the farmers on time, so that they can carry on with some kind of work at their fields. For labor, for the farmers, for now, everybody must have seen in the news that there's been this huge problem with migrant laborers in India, where people took to the streets to get back home. Fortunately for us, that does not happen so much in the rural areas, especially not at this time of the year or this time of the season. For planting, normally, people do engage with labor that is available locally. A very good example that has come to my knowledge, which is an excellent story that I would like to share, is from one of our mills in India, where they are now, they normally do in-house trainings, but because they can't call the farmers in-house, they have organized conference calls through their field extension team to have training programs for farmers, where they not only talk of the activities that the farmers give them advice on the agricultural practices, but also have been sort of educating them on how they need to take care during these times. There is a lot happening in the media, but sometimes it's very, very important to have this personalized interaction with your teams, with your farmers, and people have been using technology They have been using the method of conference calls, which is basically through a WhatsApp call, because farmers don't have computers, but they have organized groups of, they have about 700 farmers, a group of 700 farmers, so they've organized them into 70 groups of 10 farmers each, and sort of, these are basically lead farmers, then who can also, spread the word around with other farmers. This is, I thought, the use of technology here is really good, and it would be excellent for, people hearing this to see if they have any other ideas to share with us on this. It would be really nice. So far, this is, these are the main points that we would like to cover from here. There are, one of our partners has, is also, they have hospitals as a part of their company CSR, where they have, given the entire hospital now has been, there are doctors there who are just attending to patients who have been affected by coronavirus. Of course, this hospital is in the city of Bombay, and I don't know if I break protocol here, but to mention that Daniel very kindly has contributed to the hospital as well, and they have really appreciated that. It's a very small gesture, but I think it goes a very long way. And through this, I would just like to tell my colleagues from my partners in India who are on the call, thank you for being here. Just know, everyone, that we are in this together. We will do whatever it takes to fight it. And if you have any issues, any questions, be rest assured that we are right there with you, behind you. And now, that's all from India.
Thank you so much. Thank you so much, Ritu, for that information. Really good to hear firsthand how the sector is responding so promptly and well in India. A couple of questions for you, but we'll come to those at the end. So may I now hand back over to Denis? Are you technically ready for us? Yes, perfect. All you need to do probably is unmute yourself, and then over to you. And please unmute yourself, Denis. Denis? You're still, we can't do it from our end. Unless, there we go. Done.
Okay, perfect.
Okay.
Hello, everybody. I'm Denis Chavarria from Ingenio San Antonio, from Nicaragua. You will see a different picture of us, and maybe you will see no distancing practices, but it was made in, the picture was taken in the phase 3 of the pandemic. So I want to show you all the things that we are doing in Ingenio San Antonio. Ingenio San Antonio, let's see. It's located in the northwestern region of Nicaragua. We have 6,000 workers during the harvest period. And also in Ingenio San Antonio, we have a school with more than 500 students in preschool, primary and secondary school. Fortunately, we also have a hospital with 30 beds, 28 doctors, include the specialties, with an operating rooms and intensive care unit. On January 30, the World Health Organization declared an outbreak of coronavirus disease, COVID-19. we consider as a public health emergency of international importance. From the first days of February, the Hospital of Mil San Antonio attend information and training meetings organized by the Nicaraguan Ministry of Health. The ISA Hospital Authority in subsequent days informed and start training process for all the doctors and nurses in the hospital. It was in the phase one, during the stage one. The first week of March,
Dennis, sorry, before you carry on, are we meant to be looking at your slide 1, 2, or 3? Because we can see your slide 1, and perhaps you need to move us forward to the next slide.
No, it's the same one.
Okay, that's fine. Just checking.
So during the stage one of the pandemic, in the first week of March, Ingenio San Antonio created a plan to confront COVID-19. And also a health commission was created. The commission are integrated by the hospital manager, occupational health manager, and human resource manager under the leadership of administrative director. The commission is the only authority in charge of to direct the plan to face the COVID-19 in Ingenio San Antonio. After this, a training process was started for all the workers in the company, Ingenio San Antonio school, and the families, and also the family who lives next to the mill. On March 11, WHO declares coronavirus disease COVID-19 a pandemic. On March 18, Nicaragua reports the first import cases of COVID-19. Currently, Nicaragua only reports 9 cases, with apparently places of us still in stage 2, without having local community transmission. Although the statistic could be encouraging, the company has increased prevention measures to protect the workforce in Ingenio San Antonio. The first training was directed to ISA managers and bosses and include the health promoters and other occupational health personnel who were trained as a facilitator of the plan to train other personnel in different areas. All group training was carried out during the stage 1 of the pandemic. At that time, social distancing measures were not yet implemented. 26 teachers of the school and 519 students were trained also. After this, the school authorities adopt to remote education modality to continue with the school year program. To train workers in all areas, doctors, nurses, and health promoters from occupational health team train all field workers on how to prevent COVID-19. During rest breaks, by health promoters, workers receive talks about how to prevent the coronavirus disease COVID-19. We have also been in charge of training workers from other group companies. Also, workers from external service providers have been trained. Include Xochivida. Xochivida is a community association of CKD members. And also I want to let you know that EDNF men with Ingenio San Antonio recently donated 3 buses to transport members of Xochivida with CKDU to clinics in León, Managua, and Chinandega to receive the hemodialysis care.
Dennis,
yes.
Dennis, I'm really sorry to interrupt you, but I've got a few people who somehow can't see your slides, and I'm just checking on their behalf. So maybe you could just spend a second just to, I think we need to see a few more of your slides. Currently we can just see the title slide.
Mm-hmm.
And nothing else. And you've got lots of nice pictures and graphs there that would be interesting to look at.
Okay. So the transportation will reduce the risk of the patient and not to use the public transportation. And Adelante Initiative, our life in Adelante Initiative also present during the health crisis. La Isla Network with scientists and also DG to assist the plan of activity and community. We use PAHO and WHO messages, infographic related to hand washing, knowledge and actions to the COVID-19 symptoms. A support group run by Ingenio San Antonio firefighters are in charge of distributing sanitizing alcohol to all work areas. We use 1 and 1.5 liters of spray to use the alcohol and 2.5 gallon container. The company made a switch ethanol production to supply all the growing national demand for the industrial alcohol to produce 70% alcohol hell, non-cleaning products for the hospital and pharmaceutical use. This new demand and production is estimating 1.3 million liters of alcohol. To promote proper and frequent hand washing, taps were installed outside the 2 mobile clinics for field workers. Also, portable hands washing in all the fields. The hospital promote also washing at the families of the workers. Health promoters use a spray with 70% of alcohol to disinfect the hands and the field workers. Also, the drivers of the agricultural machinery, buses, ambulance, and mobile clinics have been trained to periodic disinfection for all the work units. Each driver has been trained to disinfect work equipment, distance measure and implement in place where there is a large concentration of people, such as a payroll and hiring, dining rooms, mechanical workshops. As you can see, workers are aware of the importance of the social distance at work. The dining rooms are signposted and properly organized. 2 liters of 70% of alcohol were delivered to each worker to ensure the disinfection of their family and their homes. This is an initial measure that is complete to be maintained. $600 workers were given to package a food product containing sugar, rice, beans, corn, salt, cooking, and oil, and laundry soap. During the stage 3, additional to social distancing, we will provide washable and reusable masks for all the workers. We are using an infrared thermometer in a strategic point at Ingenio San Antonio to take the body temperature for all drivers who transport sugar, and eventually we will start doing for all the workers. As an epidemiological surveillance activity of COVID-19 disease, all occupational health personnel and Mil San Antonio actively search for workers with symptoms of fever and acute respiratory infection. Fortunately, still do not have situation of local transmission in Nicaragua. The hospital of ISA have activated a plan to board patients with COVID-19. Actually, the hospital doesn't receive any COVID-19 patients. Thank you so much.
Hey, hi, Dennis. Thank you very much. Thank you very much, and that was really interesting and so refreshing to hear all the very proactive and excellent work you've been doing. If anybody did have problems seeing the slides, then we are going to be sharing all the presentations with everybody after this webinar, as well as a recording of the webinar. So rest assured, you will get the data and the photographs that Dennis shared. Okay, so we'll move on to our next panelist, who is Marit. Marit, over to you. I don't know if you have you need to share your screen, but perhaps Dennis could, as Nicholas had to do, stop sharing his screen in case you do.
No, that's okay. I will have the presentation without the screen sharing. to make sure that that I can do it without making any mistakes. I'm not very good at it yet. So maybe later on we can share a presentation with you, but I'll do it like this this moment.
That's perfect.
Okay. My name is Marit Mai. I'm the Managing Director of CNV International, as you've mentioned and as you've seen in the program. CNV International is a foundation that is linked to the second largest trade union in the Netherlands, CNV. And we do a cooperation with trade unions in several countries around the world. And also we have worked with the sugar industry, sugar sector for some time. We are partner with Bonsucro, and one of our team members is in the technical advisory board also of Bonsucro. So we're really active when it comes to the revision of the standard, of the production standard. And of course, for us, the most important in the revision of that production standard is the social themes that have to do with social dialogue, improving the rights of the workers and issues like living wage. We are active with trade unions across Latin America. And with those trade unions, especially the ones in Central America, we cooperate to talk about what we can have for input in the Bonsucro standards and in the discussions that we have within Bonsucro. And we find them very fruitful so far. So thank you very much also for organizing this seminar. I think it's very timely, and it's something that we really should see as an example also for other sectors. What we've done so far when it comes to the sugar sector is that we have started sort of a revision or a monitoring system with the trade unions, a network of trade unions in several Central American countries, Guatemala, Nicaragua, El Salvador, Honduras, Costa Rica, and also Colombia and Bolivia in Latin America. And we will try to, every week or every 2 weeks, come together and see what the effects of COVID-19 are for the workers in the sugar sector, and see, well, what suggestions we have, the things that that are happening, and get some first-hand information from these countries. And let me share some of that first-hand information, just like Ritu did from her area in Asia. I think what we see is that in the sugar sector, there's still people are still working, just as Dennis also mentioned right now. And there's so far less effect on the sugar sector chain as there is, for example, on the textile chain. We also work in textile, and we see a very different picture there. So companies are still working, and companies are very much aware of the need for hygiene measures, very much aware of the need for protection. And we see that, for example, administrative personnel is working from home if they can, or personnel that is vulnerable or in vulnerable positions are working from home if they can. People are using masks, the ones that also are on the list of the things that Nicolas also mentioned. Maybe shifts are time shifts change, and people are trying to make sure that they can avoid each other, at least have some social distancing in the work. So we think this is some really positive measures that we've seen. At the same time, we also see some difficulties. For example, people that have to go to work. So if at the workplace the situation is safer and hygiene and health measures are in place, now they have to move from houses or from maybe places where they live, dorms where they live, to the workplace. They go in buses, and the buses are often public transport or offered transport, completely full with people. I must say this is not an exception in the sugar sector. We see it in other sectors as well. So this is really, of course, a challenge, because people are then in a situation where they are more vulnerable to contamination with the virus. This is some of the things that we've seen that are really challenges. We like, I think the guidelines that Bonsucro has made are really good. It's good to have these guidelines and also to work together with employers and employees to talk about the guidelines and how to implement them, to make sure that everyone is aware of them. We've seen a good example in Costa Rica. The trade union in Costa Rica has a very good connection with some of the companies. And here we see the dialoguing that we think is very important between trade union, employer, but also government, to make sure that these measures can be implemented is taking place, which is really important. And we can see some of those results in Costa Rica, for example, that people who are over the age of 60 are working from home, but they still receive salaries. The way that buses are working are much more regulated, so there's less people in the bus to keep more social distancing in the bus. We also see that some of the outsourced workers were in very difficult positions. As trade unions, for us, the outsourced workers are also very important, and they were mentioned. Something was done for these people that live in dormitories from outside to make sure that their situation is safer as well. So it's important that the trade union also has the possibility to signal issues with the workers when the company really also wants to make sure that these things are improved. What we've seen that, for example, seasonal workers from Nicaragua in Costa Rica, they have been sent home safely to make sure that they can go home and that they are not in vulnerable positions. And also the ministry in Costa Rica is really checking upon the sanitary measures that have to be taken in place, the ones that were mentioned by Nicolas, to make sure that companies are also implementing them. We feel it's really important that here the trade union, the workers, and the employers work together to see and improve this situation. We see that it's important to make sure also to share this information, because trade unions, they can share the information, and also the necessity of the sanitary measures, the health measures to their partners, to their members. They have large groups of members in certain plantations, in certain mills, so that's important. It's an important possibility and way to reach those workers. So that, I think, is the issues that we see that are taking place right now, but we also have to look at the future. We all have seen the numbers that the IMF came up with for the economic growth, or well, non-growth, the recession that will probably come up after this COVID-19 crisis. We see also that the Inter-American Development Bank, ECLAC, has some really bleak pictures for economic development in Latin America at this moment. It will probably be a real shock later this year, a real economic shock. An economic shock, a recession that has an effect on, agricultural production change as well, probably. So we think it's really important to prepare for the future, and to make sure that here we have sort of a solidarity system in place, which includes the trade unions and the workers cooperating together with the employers, to make sure that once the costs have to be cut, the first thing is not going to be the worker who will be dismissed. Solidarity is really important now. Solidarity along the whole chain. So we think, some issues are really of importance at this moment, that we continue working on the revision of the standard of Bonsucro. We do not stop this work, and that we can continue working on this, including on the social issues, including on social dialogue, including on living wage. These are really important issues. And maybe as Bonsucro, an expert committee can be started with some members to share best practices between companies, to share best practices to see how we can improve for the future the situation, or prepare us for the situation of the future. And as an organization from the Netherlands, but also as a foundation that has solidarity and decent work at heart, we would really like to cooperate and to make sure that we can come out of this crisis in a more sustainable way, and that we will use this for the best, and make sure that those issues that we can improve, that we will improve them for both for companies and for workers in the sugar sector. Thank you.
Thank you very much. Thanks. That was really interesting. You covered a lot of ground there. It came across perfectly without a presentation. So thanks so much.
I will not share my presentation then.
Oh no, you can share your presentation. We can share it with all the participants later. I'm sure they'd like to see it. And thank you for bringing up the really important point around solidarity and supporting one another. From your point of view, particularly workers, but other people have mentioned all the way along the supply chain, as we sort of try and get over this chasm that's opening up, this economic shock. I'm going to move to our final speaker, who's Claudia Asensio. Claudia, I don't know if you had a presentation or if you're going to speak without a presentation. There we go. Okay, great. And then lots of questions are coming through on the chat box question. If you could use the Q&A function for your questions, it's helpful. And then I've identified some questions we'll be bringing to the panelists at the end. So over to you, Claudia.
Thank you so much. So we, just to do an overview, because we're present in different countries, the response has been different as we go along, and that's that has more to do, with how each country has responded. And so Guatemala, where I am stationed, the government decreed a state of calamity in March 5th. And then starting March 21st, government stated nobody could leave their homes between 4 p.m. and 4 a.m. and requested the closing of businesses and schools and other things. We've seen Nicaragua with no real official response yet. Mexico, Brazil, and US also declared national emergencies at different time points. And so that has had its challenges, because as a company, we've tried to establish protocols, same protocols across the board. And if employees who are living in these different countries are not getting the same message from their governments, in the beginning, that caused a little bit of disconnect. Where we are now, the total number of cases, like you said before, Danielle, is not confirmed, and obviously limited testing and knowledge as to the number of cases may not be accurate. And here, I've stated where we are and the number of confirmed cases versus deaths. And this also has to do, the confirmed cases, with the number of testing. And in my opinion, without widespread testing, we don't know how the pandemic is spreading, nor how to appropriately respond to it. And I'm going to come back to testing in the end, because our milling seasons are ending in the Latin American countries. They've just started in Brazil a couple of days ago, and reinserting workers either back into their communities when they're done with the milling season, and looking into the future when November starts, how they're going to come back to work can be a challenge if widespread testing is not available, and that also varies between countries as to what the policies are. So specifically, us as Pantaleon, we activated our first crisis management team on February 25th. Integrated a management plan on March 13th, and over that weekend certain measures were implemented, and the first disease prevention measures were implemented that Monday of March 16th. A little bit zoom in of what we've done so far. 5 main areas. One is social distancing. We banned quickly all international travel and instilled home office starting that Monday, the 16th, wherever possible. All social gatherings were banned, including using the mill restaurants and cafeterias. People, were requested to do pickups. We increased transportation services to allow for social distancing, banned entry of all external providers to mills, and then also established for our cane cutters in the countries where they live in areas that are provided by the mill. We established isolation areas for those workers who presented symptoms. In terms of disease prevention, we've had a really, really strong communications campaign. We have a really neat tool that we use. It's called Actimo. And because we have the cell phones of our workers, we're able to push notifications and communications to all employees using videos and different infograms and whatnot. And our communications team has done a great job at teaching employees in terms of disease cause and prevention and whatnot. We've provided 100% of our employees with masks. all of them, when they come into the mill, receive a temperature measurement and respond to a set of questions. The latest that we've wanted to incorporate is whether or not people have lost their sense of taste and smell, because that appears to be one of the symptoms that comes up initially for people with COVID. We've also done a lot of workplace disinfection of the buses during each shift, because we know who has what type of chronic diseases through our health clinics. All employees above 60 with a diagnosis of chronic diseases have go home on quarantine. This does not mean that they're not getting paid. It just means that they're safe at home, trying to do remote work. And then lastly, we've requested all employees to keep a contact log of all the people that they're in contact with each day. And that allows for, if there's a case or if there's a person who presents symptoms, then whoever they've been in contact with, and if there's need to go on quarantine, then that can be implemented. In terms of continuity of operations, what we call a third shift, so to speak, was created, where people were sent home or are being sent home for 14 days to be quarantined in case a worker tests positive or has symptoms in the area where they are. That response team can come in and cover for that set of workers who needs to be quarantined or placed out of the mill. Obviously, supply chain is also a big risk, especially when we're going into the repair season and there's need to do repairs in the mill. So we've been very careful to make sure that our inventory and stock control is in place and that we've had timely procurement of critical supplies. We're maintaining obviously strict quality and safety standards for all final products to keep our exports going. And then an ongoing screening of governmental restrictions that may interrupt business cycles. For example, with this ban in Guatemala to be able to circulate between, or not be able to circulate, excuse me, between 4 p.m. and 4 a.m. in the morning, special permits to allow us to do that so that we can continue feeding the mill with cane, transporting people in safe conditions, and then also complying with our sales commitments. Moving on to our health team. Our medical staff was retrained on contact precautions. That was a first and a must to understand the different types of contact precautions. Also, ongoing understanding of the coronavirus based on evidence-based practices and resources covering topics from symptom management to diagnosis to treatments and ongoing wellness. This does not mean that we're treating patients or that we would be treating patients with COVID-19. By law, in all the countries, patients that are found to be symptomatic or a very highly suspicious case needs to be reported to the national social security system or the national health system. But we did set in place a protocol and algorithm to manage suspicious cases. We created a specific isolated area in our health clinics to attend workers with respiratory symptoms. And we also activated telemedicine services on behalf of our health team to avoid people to come into the clinic and be contagious to the rest of the people who are there. Last but not least, a lot of local and government aid. We've the same communication or a photographer of the same communications campaign that we've done with our employees. We've worked in conjunction with the local governments, giving out banners and setting banners in communities and whatnot as to disease prevention and symptoms and whatnot. We've provided more than 2,000 masks for local community members and hope to provide more than that. We've also donated prevention kits to the local government. We very quickly maximized our ethanol production in Guatemala and Brazil to donate alcohol and hand sanitizer to the public health system and other government authorities. So far, we've donated over 150,000 liters of hand sanitizer. We've provided aid to repatriate Nicaraguan and French citizens who were left stranded in Guatemala. Borders closed really quickly. We had employees, Nicaraguan citizen who are employees of Pantaleon stranded here, so we were able to repatriate them back. And then via the Guatemalan sugar industry, we supported the donation of $1 million to equip an interim hospital for coronavirus patients and the provision of land for construction of that hospital. We've also supported the donation of more than 100,000 pounds of sugar to families in need. And because we cogen, the Guatemalan energy industry also donated $1 million to the government for coronavirus response. Here are some pictures, these are just, they come from our NEAT app of what we've been sharing with our employees. This is on a daily basis, sometimes multiple times a day. And this is the example of what we're sharing of keeping that contact log. And because we've done the stay at work, then how to use all the WebEx, Teams, Skype, Zoom, all the virtual meeting spaces. Some pictures. This top left is the start of our milling season in Brazil. And this is a personal note. My take is, amidst the apocalyptic and economic news that we've faced, hundreds of thousands of individuals are working together to find solutions to this pandemic. New diagnostics, therapies, antivirals, and vaccines are coming at great speed. I know that there are several companies that are currently testing for that vaccine. Never before has the world seen such collaboration, and I believe that our mindset as to how we tackle this pandemic is everything. That's it. Thank you.
Thank you so much, Claudia. That was really inspiring presentation about everything you've done. You've obviously written the handbook there, so I think it's fantastic, and I'm sure your presentation will be very eagerly consumed by everybody on the webinar today. So thank you. There's some questions coming through, and while you're there, Claudia, I'll just ask. There's one or two questions directed to you. One of them is around for the repair maintenance season. Have you thought about any measures you would put in place before hiring new people in terms of sort of medical evaluation and so on?
It's ongoing because we can't do massive testing, and as you know, the IgM or antibody testing has its pros and cons. We would be screening people. One is this idea of the smell, taste and smell. Two is obviously doing temperature measurements and checking for respiratory symptoms. Three is part of the questionnaire is asking whether people have been in contact with someone who has been in quarantine, or a risk has been if their spouse or family member or someone who they're in contact with is part of the medical profession or part of the relief services that Guatemala has, because that would place them at a higher risk. So that's part of our algorithm. If those people are at high risk, then we would probably move them into other confined workspaces versus placing them in an active work role.
Okay, thank you. Yeah, that's great. And another comment I thought it would be interesting just to stress for people listening is apparently you developed this response in discussions, including your workers or the unions. Is that? Would you like to comment on that? Seems.
Yeah, what we've done is we have what we call these moments of dialogue, and we also have this figure called ambassadors, where it's a kind of a train the trainers model, and then the moments of dialogue is the space where people are able to discuss between workers, and there's constant communication there in terms of what's being done and ventilating questions and whatnot with the workers. That has been very helpful in bringing people on board and hearing out concerns and whatnot on behalf of the workers.
Great. Okay. Thank you. Thanks, Claudia. I'm sure Marit will be really pleased to hear that as well, how that engagement's going. Mm-hmm. Some questions here that have come in for Nicolas, for Bonsucro, really, about certification. Some comments that we can't allow, sustainability matters more than ever, and what's Bonsucro doing around making sure that audits are able to continue even with these restrictions. So that's a question for Bonsucro and for Nicolas to answer.
Yes, indeed, sustainability has never been more important, and I think it's something we encourage always the stakeholders to look at as prevention and solution measures to the challenges we are facing now. In the term of audits, and we have been in liaison since the beginning of the crisis with our certification bodies, license certification bodies, because they face the same restriction that we all face in travel and lockdown within their own country, and the inability for them to travel across country. And we are working on them to find adaptation measures and mitigation measures in the way they can carry out some of their activities remotely and or having to wait for on-site audit. So each case is very specific. Each case will be unique according to certification body and the unicity of the uniqueness of the producers. But what we recommend is that any certified companies whose audit is likely to happen in the coming months get in touch with their certification body to discuss the options between delaying the audit, going through part of the audit that could potentially be done remote, and seeing what are the options available. So they will be the best to answers. We recognize the situation. We really want to work with everybody to avoid, to avoid challenges into the running of the audits and certifications. Yeah.
Thanks, Nicolas. It's something we're actively working on with our certification bodies, and everybody should contact their CBs as a first priority. And then a second question for you, Nicolas. An interesting one. Somebody said, will this WHO guidance around risk management and COVID-19 become embedded as a compliance requirement in the coming time for Bonsucro?
No, it's not intended to become, it was not intended to be written as a standard requirement that are going to be audited and that will be potentially sanctioned by compliance or non-compliance. It's separated from the standards. It's aligned with the standard. It helps the implementation of the standard, but is another category of support that Bonsucro is providing to the sector.
Thank you. A couple of questions for Denis. Denis, somebody's asked around testing. Are you running any testing? Do you have testing capacity, or and indeed, do you know anything about the situation in Nicaragua around testing for COVID-19?
Well, in Nicaragua, the government is the only institution in charge of testing in COVID-19. The only thing that we are doing in Ingenio San Antonio is checking a patient or worker with fever and symptoms with infection, respiratory disease, and at this moment we don't have any patient with fevers and cold, and unfortunately we really don't have a patient in our company. But unfortunately, to make a COVID test, all the patient has to go, the sample has to go to Managua, and only the government can make the test.
Okay, thank you. And maybe if you could comment, we've had a few questions around social distancing and the need to have social distancing across all the operations, so transport, resting areas, technicians, field workers. I was wondering, what do you think would be, what are the implications, both the practical implications and the business implications of having so much social distancing in your business?
This is a real problem, specific when the people are having the rest in the field. What we are doing is taking the toldos at the rest time. The people are using the toldos and also are using the natural shade. But we are in plan to increase the number of toldos in the fields. And also for the transportation, and the next week we will start to give in masks to the 100% of the workers. And fortunately, the SAFRA will finish in the next 5 days of the next 5 days.
Okay, thank you. And do you foresee any other practical implications, or for also for Claudia as well, in terms of social distancing, if it continues into the harvest season? Do you foresee how it might impact on the efficiency of being able to harvest?
I don't have the numbers quantified, but I think it will have an impact. And I just want to say, we don't talk about it enough. I am a bit concerned about mental health for all employees, including all of us who are in this phone call, with regards to the virus, the response, the social distancing, working from home, et cetera, et cetera. I think that hasn't been part of the conversation enough in social media and other places. I'm a huge advocate of doing internal work meditation, whatnot, but I think that's something to take into consideration for workers, because it can take a toll both on their own and with their family members.
Absolutely, thanks for raising that, Claudia. Of course, and of course, there's something like, apparently at the moment, 1.5 billion children who are not at school, who are not able to go to school. That's, I mean, it's tragic, and it will be definitely taking a toll on everybody, on all of them. So absolutely, mental health is something that we need to be more explicit about addressing in our response, and something that we can reflect on further. And thank you, Marit, for raising the point about Bonsucro could put together some kind of task force committee to take this work forward. I think that's something we definitely need to sort of think through how we can do that. There's so much positive experience and practical experience that's coming through this webinar, and all of our engagements are showing that. So we clearly can add a lot of value. Just going through any other questions before starting to wrap up.
I had a question here on
Yes.
the Q&A feed with regards to Mexico. Mexico, we're working with the cane associations, Cona de Azúcar, and the Health and Agriculture Secretary, the Zagarpa, to create protocols for our workers there, and transferring the best practices that we've had with internally.
Okay, thank you, Claudia. One comment, one question I thought was interesting, and maybe Ritu, I don't know if this is something you would be able to respond to. It's around migrant labourers, or any of the panelists really. It's around migrant labourers, and just an update really on the impact of migrant labourers. What's happening to them? Are they still there? Have they gone back? And I know in India this has been quite a big thing.
Yes, so like I said earlier, a lot of what we have been seeing on social media has been, the migrant labor that resides and works in cities. So the movement is from urban areas back into the rural areas. Just to bring to the notice of the person who's questioned, there is There have been a lot of relief camps that have been set up for migrant laborers as well now. There are 3 meals being provided to nearly 7 lakh migrants. This is all information that I have received from the government website. And they have been given medical assistance. As far as the work at the mills is concerned, within the mill, if there is any maintenance work that is going on now, these are mainly with people who live within the campus. There are no people coming in from outside. As far as the that's the update that I have.
Anybody else would like to comment about migrant labours and the impact it's having? Okay. A question around field labourers and their relationship with trade unions. I don't know if Marit, are you able to talk about that at all?
Well, I think here we see a mixed picture. Sometimes they are included in trade unions. Sometimes they are a member of trade unions. Sometimes they're not. It depends also on the situation in the different countries. What we do see is that some trade unions are very much aware of that position of people, even though they're not members, and they include them in the discussions that they have, and they include them in the social dialogues, and they include their, at least they speak for them to make sure that also their needs are being addressed in the social dialogue. But sometimes they are members also of the trade unions. It's a mixed picture.
Okay, thank you. I think we've answered most of the questions. Unfortunately, some of them are quite specific, and I don't know if we'll be able to address them. There was one around what's the impact of COVID on bioethanol offtake, and one about the perspective of production in Brazil. Perhaps those are something we could address in further webinars. And then a comment around the insecurity that communities are feeling in Nicaragua in particular, about workers returning into their communities from other places, and potentially, I suppose, coming and transmitting the virus. So I think I'll draw to a close the Q&A section. We're coming up to time for today's meeting, and really I just wanted to sort of just to close a little bit with some next steps for Bonsucro, because we need to focus our response around our core business as a platform for sustainability in sugarcane. And the timing is quite fortuitous in a way, because this year Bonsucro is undertaking a strategic review. So we will be able to reflect upon this new situation and incorporate it into our strategic review as well, and reflect more deeply about, because we are going to be living with this situation, and indeed other crises are, it seems, increasing in our world, and how do we as an organisation, as Bonsucro, best set ourselves up to respond to crisis and support our members. So as we start that strategic review, in the meantime, we really welcome all of your suggestions and ideas. So please do share those with us, what you'd like to see Bonsucro doing, and we'll reflect and see how we can respond. We'd like to know what you think about today's webinar. Maybe you could, in the chat box, you could give us a score from 1 to 3, 3 being the highest, as to what you thought about today's webinar. Just a quick review, and if it's positive, then we want to organise some more and take different thematic or regional focus, and again, suggestions welcome. We want to develop the guidance that Nicolas shared at the beginning and build on that with all the experience shared by today and by other members, and create something that's more relevant also for the smallholder farmers. We're going to be putting together an information hub on our website with resources from authoritative sources, and that will be available to the whole sector, of course, not just our members. And we also will be working with our partners to identify what resources they may have that are available on offer free of charge to you. People, as Claudia said, you know, the positive side of this is just the huge amount of goodwill and collaboration that everybody is showing up with at the moment. So, for example, our lawyers have put together a resource hub around business risk. We have a technical partner called Supply Shift, who are offering a free of charge use of their supply chain mapping tool that we are going to be able to offer to our members, that might be useful tool for you to map, especially for the buyers, to map how COVID-19 is impacting on your suppliers, and start to draw some analysis and conclusions on that. And we'll be writing to our members with information about how you can take part in that. And any other offerings that we think are relevant and pertinent, we will be sharing with you, our members. And just really to sort of to close that, you know, the role of responsible business is going to be critical for us all to emerge positively from this period of uncertainty. We don't know quite what the impact will be and what the world will look like after the economic shock, but we do know that it certainly makes the case for sustainability and for Bonsucro and all the work that you guys are doing on sustainability much more compelling and critical. And just to close, to remind you that for Bonsucro members, we have our new code of conduct, which encodes members' commitments to continuous improvement and respect for human rights, which we haven't explicitly touched on today, but it's potentially a topic that we need to explore further in further webinars. But I just want to invite our members to join. We have a series of webinars in different languages next week, which will take you through the code of conduct and what it means for you as a member to demonstrate your commitment. So please look out for that, for the communications from us, and I hope to see a further 100 and odd participants in those webinars next week. So with that, I will close the meeting. Oh, we have here a poll. Was this webinar useful for you? And you can do it on the poll there. Yes or no. Okay, thank you very much. And to our panelists, thank you so much. I thought it was really inspiring and really interesting to hear from you all. So I'll leave the portal open just for a few more minutes for people to vote in the poll, but that's the end of our discussions for today. Stay safe, everybody. Thank you.
Thank you. Stay well. Bye-bye.
Bye-bye.
Thank you. Bye-bye.
Thank you.